Hello and welcome to Healthy India. I'm Lottie Alaric. I'm here with you once again to take you on this journey of good health in the next 1 hour. As we all know that we see a number of cases emerging of dengue fever, so it was only right for us to take this as a topic of discussion today. So to tell you more about this fever, I have in the studio an eminent panel of doctors. It is my privilege to welcome Dr. Sunil M. Raheja, who is a physician at the GB Pant Hospital. Sitting to his right is Dr. Sanjeev Sinha from the Department of Medicine at the All India Institute of Medical Sciences. And to my left is Dr. Pawan Kumar, CMO, Director of Health Services, Directorate of Health Services, Government of Delhi. So I take this opportunity of welcoming all three of you to the show. Well, friends, before we start talking to our guests and before I invite you to ask your questions, let us all take a look at this report.
Dengue is the most common mosquito-borne viral disease that has become a major health concern in recent years. It is transmitted to humans by the mosquito Aedes aegypti and rarely Aedes albopictus. Classical dengue or dengue fever is characterized by a sudden onset of fever, joint and muscular pains, headache and rash. There may also be gastritis with some combination of associated abdominal pain, nausea, vomiting or diarrhea. Some cases develop much milder symptoms which can, when no rash is present, be misdiagnosed as flu or other viral infection. The classic dengue fever lasts about 6 to 7 days with a smaller peak of fever at the trailing end of the fever and can be diagnosed through a blood test. The mainstay of treatment for dengue is supportive therapy. The patient is encouraged to keep up oral intake, especially of oral fluids. However, supplementation with intravenous fluids may be necessary in some cases for preventing dehydration. Like most viral diseases, there is no specific cure for dengue fever and no vaccine for its prevention. Primary prevention of dengue mainly resides in eliminating or reducing the mosquito vector for dengue. Personal prevention consists of the use of mosquito nets and repellents.
Well, we are definitely seeing a lot of rise in dengue fever cases. So, Dr. Raheja, if I were to ask you as to which are the states that you find more patients of dengue these days?
Yeah, dengue in India is more common in Punjab, Delhi. The today morning figure in Delhi is 718 cases reported this year and 5 deaths. And besides this, it is more common in Karnataka, Maharashtra and eastern parts. And if you take the total global scenario, almost 40% of the world's population, that is 2.5 to 3 billion, that lives in the hot zone, where this disease is endemic. And that includes Southeast Asia, India, Sri Lanka, Pakistan, Bangladesh, South African countries and South Pacific, that is tropical and subtropical countries. And every year approximately 50 million patients are affected with dengue fever. And if you see the mortality dengue fever as such, if it is a simple dengue fever in which there is just fever and body aches, myalgia, it is like a viral infection, like any infection, the mortality is even less than 1%. But in the severe form of dengue fever, that is dengue shock syndrome and dengue hemorrhagic fever, the mortality may be as high, varying from 5 to 44%, depending on the type of treatment the patient is getting and the medical facilities are available.
That's right. So, Dr. Sinha, do you think that because mosquitoes are such a common problem everywhere that people don't really take this very seriously, thinking that, oh, this will just go away, it's just a rash and it might just go away. So, do you think lack of awareness is one reason where we find people getting affected with this fever and then eventually dying?
Yeah, you're correct. Actually, one have to understand the signs and symptoms of the dengue fever. So, any person who is having high grade fever with chills and rigors, patient is feeling cold with high grade fever, he can have headache, he can have body ache, can have joint pain. Then as recently told in your program, patient can have recurrent vomiting, he can have loose motion. Then top of that, after 3-4 days, patient can have rashes on body. That is very important sign one have to understand. So these are the common sign and symptom one have. Then they have to be immediately contact to the doctor. And we have 3 types of dengue fever. One is simple dengue fever. In that, patient can generally improve in 5 to 6 days. And other is dengue hemorrhagic fever, where patient can have rashes on body and high grade fever, recurrent vomiting, and then patient can have sometime active bleeding also. And severe form of dengue fever is dengue shock syndrome. In that, patient have including these features, patient can have active bleeding, and then they can have hypotension, and they can go in altered sensorium, and ultimately they can lose the consciousness.
All right. Now, Dr. Pawan, as you just explained, the symptoms that that are there of dengue fever. But I think for a common man, it could be very confusing whether it is malaria or it is dengue. And malaria, people think that they can get cured just by going and getting some over-the-counter medication. So, as a doctor, what would you like to tell?
Yeah, in initial stages, whether it is a dengue fever or chikungunya fever or malaria or any viral fever or enteric fever, all fevers, they look like same in initial stages. But however, if we talk about dengue have some characteristics which are different from other fevers, like dengue fever has a high grade fever with rigors and chills, but there is a more of myalgia, arthralgia, retroorbital pain, the arthralgia, and the patient may, if goes into dengue hemorrhagic fever, then the patient may have a bleeding tendency, the small red spots on the body. They may be vomiting from the mouth with the red blood, or in the stool blood can be there, the black stool can be there. And if it goes in a further serious state like dengue shock syndrome, where patient can have a low BP, thready, weak pulse, then patient can go into a shock also. However, if we talk about chikungunya fever, initially the same features, but in chikungunya, patient will be having more of a joint pains, small joint pains, migratory joint pains, and the disease is more of a debilitating time. Person will not be able to do his routine work because he or she might suffer from joint pains, and that may subside for a longer period of time. But in case of dengue fever, if we see the fever history and the normal protocol of the fever, it goes down after a symptomatic treatment. In case of malaria, you may have a rigors and chills fever, and which maybe subsides with the paracetamol, but it comes again in peaks. And same time you can have a slide of fever, the blood slide, you can see the parasite, how in initial stages we can differentiate the fevers.
Right. So, Dr. Raheja, does that mean that for any kind of fever that a person may come down with, I think the first thing that they must actually do is go for some kind of diagnosis from the right doctor?
Yes, as Dr. Pawan has said that, in the beginning, now this season is, we are having viral fever.
Yes.
Dengue fever, chikungunya, malaria, enteric, or any per se upper respiratory tract infections. So, all these in the initial stages, they almost look similar.
Right.
Like in dengue, the typical feature will be high grade fever with chills, and the fever may be biphasic. The fever will come and there will be severe myalgia and body pain.
Okay.
It is also called the break bone fever. So, it is very typical. The patient will have a severe body ache, myalgia, lethargy, and while moving the eyes, he will have pain, severe headache, nausea, vomiting, and in severe form patient can have rash, and the rash will first appear on the arms, legs, and they are reddish in character, reddish, you can say bumpy type, that is we can say erythematous rashes, and they can spread over the body later part. And in the other form of dengue hemorrhagic fever, the patient, like in the 5 days, the things are almost same, and the best way is to go to a physician who will take a proper history. In malaria, the fever may be alternate day, depending on the type of malaria, and we can do some test like for dengue in the first 5 days. The common test available is ELISA NS antigen 1.
Okay. So, is this a blood test?
It's a blood test,
okay,
and it is available everywhere, and it is positive in the first 5 days for dengue. And after 5 days, the antigen will disappear from the blood and the antibody will appear. Okay. That is serology, ELISA IgG test. Then that will come positive for dengue fever. Similarly, for chikungunya, if we want to test the blood after 5 days, we will get the antibody for chikungunya IgG after 5 days. For malaria, the test is very simple. We can go for a simple slide test, peripheral smear, thin and thick smear. which is very commonly used for years and decades. Very indicative of type of malaria also. We can go for the malarial antigen test also, even for, and the other fever is enteric fever. For that again there is a rapid test and there is a Vidal test which comes positive of 7 days.
Okay.
So, basically it needs a careful history taking clinical examination,
Right.
and by that we can decide. Even in dengue, first 5 days there will be high grade fever. The only complication starts with dengue hemorrhagic fever on 6th or 7th day. Once there is a fall in blood pressure and then followed by the fall in platelet counts and all this complication in the severe form, this will talk, I think, in the further talk.
Right. Now, I think the people, all those who may be watching today, they all would want to know as to what is the time usually when this mosquito is in the air. Because what I have here is it says that the highest biting intensity is about 2 hours after sunrise and before sunset. So, is that true?
You're correct. Actually, this mosquito is Aedes mosquito is generally day biter.
Okay.
So, it bite in the daytime.
Okay.
Mostly in the early morning, 2 hours after sunrise, and then in the afternoon before sunset.
Okay. So, is there any way of recognizing this kind of a mosquito? Does it look
this
any
is
different
we generally call it tiger mosquito. So, if you see there is a lining there like tiger on the body of the mosquito.
Okay.
So, you can recognize by that. And then it is like if any mosquito in daytime bite, then one have to be careful. So, that's why we advise during raining season from July to October, one have to be very careful. They have to cover the arms and cover the limbs, lower limbs, and they have to take care from mosquito bite in the daytime also. Generally myth is the mosquito bite is only in the night time, but this is typical mosquito and bite in the daytime also.
All right. Well.
Yeah.
For all of those who've just tuned in, this is Healthy India, and today we are telling you all about dengue fever. So keep listening carefully, as this is one fever that is emerging everywhere. So right now, time for us to slip into a break. When we come back, we'll have a lot more to tell you about dengue fever. So don't go away, as we'll be back in just a moment.
कानूनी उलझने, अनसुलझे सवालात, जाए तो जाए कहां? जवाब हमारे पास।
Welcome back. You're watching Healthy India, and today we are talking about dengue fever. So if you have a question regarding this issue, please feel free to call us. Our lines are open right now, and the numbers are 1800115314 and 23035420. Remember, we are talking about dengue fever today. And when you call us, keep the volume of your TV set to the bare minimum so that I can hear you and I can entertain your calls. So please remember that. Now, Dr. Pawan Kumar, here we are talking about dengue, but then there are these typical forms of dengue. Some are mild and some could be very severe. But for a common man, how would he be able to differentiate between all these?
You see, if we talk about the dengue fever, then it has 3 types, we can say. The one is the dengue fever, the simple fever. Another is the dengue hemorrhagic fever, DHF. Third is the dengue shock syndrome. Coming first to the dengue fever, it is a simple fever, may be for 2 to 7 days, simple fever with a lot of myalgia, arthralgia, malaise and headache and pain behind the eyes, and it subsided with the normal paracetamol we take.
Okay.
After 3 or 4 days, sometimes what happens, the patient is normal, the fever comes down normal, but suddenly after 1 or 2 days, he or she may have bleeding spots. Bleeding inside the body, maybe from the gastrointestinal tract, from in the stool, and the patient may go into a dengue hemorrhagic fever. In dengue hemorrhagic fever, what happens? The platelet counts, they come down, and the blood counts in the body, hematocrits, they may fall, or depending upon the circulatory state, they may increase. The concentration may increase, and if the platelet counts they fall, the reason being is because of the immune complexes formed in the body because of the virus. What happens, the immature platelets, they come into the circulation, which are ineffective for clotting purposes. Second, there may be a endothelial lining, there may be a leakage of fluid, there may be ascites. Ascites means fluid inside the abdomen, the pot belly, the pleural effusion, fluid inside the chest. It may collect, and sometimes the platelets, they are used inside the capillaries. So the overall platelets available for the body, they are less. This is how the dengue hemorrhagic fever proceeds.
Okay, I'll come to the third one, but before that we have with us Mr. J.N. Rao from Maharashtra. So Mr. Rao, if you're there with me, welcome to the show.
Thank you, madam.
Yeah, please
My
go ahead.
question is, what is the stage of research in finding an immune vaccine for dengue fever in the world, and the importance of clean environment without stagnant and stored water?
Right.
Please highlight that. Thank
All
you.
right. Well, that's a good question, and let me see what Dr. Raheja will tell us.
The first thing I will tell you, it is very difficult to create a vaccine for dengue because there are 4 serotypes, DEN1, DEN2, DEN3, DEN4, and it is the very complex virulence of the virus. And if we see the history, if the person is affected with one serotype, the antibody are formed only against that serotype. Like DEN1, a person gets an infection, antibodies are formed, and it will only end up in a simple dengue fever.
All right.
In which the mortality is even less than 1%. 99% it will go as a viral infection. And if suppose the person gets infection with say different serotype, serotype 2, like in Delhi, we have got serotype 1 and 2 at present. So because of the antibody development enhancement, there is already antibodies, the bodies are formed. So the person will have more chances of going into the dengue hemorrhagic fever and dengue shock syndrome. That is the more severe form of dengue fever. So a vaccine was developed in Thailand, Chimerivax, which was tried in monkeys, and it was effective to the tune of 92% in monkeys.
Okay.
But once it was tried in humans, the efficacy was 20%. So the most important point to note here is any vaccine which is to be developed should be effective against all the 4 serotypes equally. Suppose the vaccine is effective against 3 serotypes and is not able to combat the one serotype, then if the mosquito, there is a bite of that serotype to the person, it will lead to a more complicated form of dengue fever.
Oh, all right.
So now you can understand the complexity of the virulence and the overall status. That is why it is very difficult to develop this vaccine.
Right.
And we are still in the developing stages. Now stage 2 or stage 3 trials are going on, and maybe it takes few years to develop this vaccine. Maybe there was a report by 2015 it may be available.
All right.
But
Well,
it all
till then, I
depends
think
how
prevention is the
successful
best cure.
it is going to be in the trials.
Right. Well, so till then, I think prevention is the best cure, and you only have to save yourself from mosquitoes. Well, now we have with us Rupal Sharma from Haryana. So, Rupal, are you there with me?
Yes.
Yeah. Welcome to the show, and go ahead.
My question is, my question is, अगर डेंगू में ठंडी पट्टियाँ रखें तो कैसा रहेगा, मतलब कितना फायदेमंद है?
Okay, those cold compresses, I think she's talking about. Yes. तो अगर ठंडी पट्टी वो रखना चाहें तो.
It will be very helpful. See, we told in beginning, in dengue fever, treatment is supportive. So like if any patient who is having high grade fever, so it will be very helpful, and we advise to the patient, do hydrotherapy, do cold sponging, put this cold sponge on head and other part of the body, and with the hydrotherapy we advise kerosene like paracetamol also to decrease the temperature. So main purpose of giving hydrotherapy to decrease the high grade fever.
All right.
Yeah, the most important is the water should not be very cold.
Yeah.
If the water is very cold,
Then again, the temperature will
then
not
there is a
come down.
vasoconstriction, you know, the blood spread to skin is less, so it gets less effective. The most important is that the water you use for hydrotherapy should be used all over the body.
Right.
The
Normal
patient
water.
clothing should be opened, the fan should be on, and with that, once the, you know, it's evaporation and cooling, simple mechanism.
Okay.
Once the water will start evaporating from the body, it will have a cooling effect on the body. And the most important is, if anybody is having suspected dengue fever, without proper diagnosis, most important is only the tablet paracetamol is safe. Beside this tablet, aspirin, diclofenac, ibuprofen, all these medicine drugs, they have they really affect the function of the platelets. So if a person of fever is given these tablets, I will repeat again, ibuprofen, diclofenac, aspirin, the efficacy, the efficiency of platelet will go down.
Alright.
So,
So which
that
means
will lead to
paracetamol
more
is the
chances
only-
of bleeding.
Right.
And it can make the simple fever into a complicated fever in the later
Right.
part.
So I think
so
people-
the public should understand
Yes.
only paracetamol is safe, as Dr. Saab has told. Hydrotherapy is with the normal tepid water is okay, and then consult your doctor. And most important is any fever, you must give lot of liquid diet to the patient.
That's
The
right.
person should be given lot of liquids, the hydration should be maintained 3 to 4 liters, and by hydration we mean we can assess whether the urine output is good.
That's right.
That is the first sign. You know, decrease in the urine output is the first sign of dehydration, and that should be monitored very closely. In any patient of fever, we must make sure that the whether it is child or adult is given more amount of liquids.
Liquids, right. Well, I think these are very important points that people you must keep in mind as far as dengue fever is concerned, or probably any other fever. Well, right now we are joined by Mr. C.M. Jetli from Mumbai. So, Mr. Jetli, if you are there with me, welcome to Healthy India.
हाँ नमस्कार। देखिए, जब बुखार होता है, यहाँ मैं बम्बई की बात कर रहा हूँ, न्यू बम्बई, बम्बई महाराष्ट्र में, तो डॉक्टर उसको ना सबसे पहले तो मलेरिया की जो दवा है ना वो देना चालू करते हैं। बोलो मलेरिया है या डेंगू है कि चिकनगुनिया है कि कुछ और फीवर है, तो उससे आदमी के प्लेटलेट्स इतने कम हो जाते हैं कि लास्ट में डॉक्टर बोलते हैं भाई सरकारी हॉस्पिटल चले जाओ, हमारे हाथ में कुछ भी नहीं है। जबकि मेरे हिसाब से प्लेटलेट 1.5 से 2 लाख होने चाहिए, वो 5 से 10 हज़ार तक आ जाते हैं और आदमी की जान को बनती है। कुछ ऐसा सिस्टम है कि जैसे कि समझो कि कोई भी दवा दे रहे हैं डॉक्टर, साथ साथ में प्लेटलेट मेंटेन करें, प्लेटलेट बढ़ावें, उसकी दवा देने। और कोई ऐसी दवा है कि आदमी यदि वो खाता है तो कम से कम जिंदगी भर उसकी जो प्लेटलेट्स है ना, उसकी इम्यूनिटी है ना, वो बनी रहे, क्योंकि प्लेटलेट का कम होना बहुत डेंजर है। और दूसरी बात मैं और पूछना चाहता हूँ, डाउट है थोड़ा मन में, कि यदि प्लेटलेट समझो के लिमिट के बाहर बढ़ गए तो उसका कोई साइड इफेक्ट है क्या? धन्यवाद।
Okay. First of all, Mr. Jetli, I must say that any right doctor will not just start, giving out treatment without actually diagnosing the disease first. So I don't think it is right to say that the doctor will quickly start treating you for malaria. I don't think I'm going to agree with that. But yes, if you go to the right doctor, the qualified doctor, the first thing he or she will do is actually run a battery of tests, and only then the treatment will follow. And now you can give the answer to the second.
I want to say, it's a myth in many patients, you have to immediately start platelet. So we would like to stress here, role of platelet comes only when patient is having active mucosal bleed,
right,
or active bleeding, or patient is having very low platelets like around less than 10,000. Otherwise we don't give platelets. Okay, and as mentioned by Dr. Pawan, generally what happened in dengue fever, there is a restriction of platelets because of various causes. So generally what happened, one have to be measure platelet every day, minimum 1 or 2 times. So once you have doubt of dengue fever, patient have to be go doctor, and every day we have to be measure platelets 1 or 2 times.
Right.
Generally what happen after 4 or 5 days of fever, there is decrease in number of platelets.
Right, right.
So if you are in continuous contact with doctor or you are admitted in the hospital.
Now, since we are talking about the platelets, I think Dr. Pawan, I'd like to ask you here that most people believe that, if they have goat milk, their platelet count is going to go up. And because of that, in certain states, especially Punjab, goat milk is being sold for 300 rupees a litre. So first of all, is it a myth, or does goat milk really help?
Yeah, it is a myth only. There is no scientific evidence like milk goat or any juices or they are going to enhance the platelet count in the body. There is no scientific evidence. However, if we take juices or milk, they may be a nutritious, general nutrition for the body, but however there is no effect on the platelets. It is because of the immune complexes in the body. We have already discussed there are various scientific causes to have platelet count down in the body. There is no scientific evidence for that.
Yeah, right. The most important to understand is the platelet count in dengue fever. They will start to fall after 5 to 6 days. So it is basically a immune complex reaction in the body which leads to this antibody development enhancement. So the most important fact is that the platelet count even below 20,000 and the patient is not bleeding, there is no need to give any platelet transfusions.
That's right.
Because in dengue fever there is a qualitative defect in the platelet and there is a quantitative defect. So it depends. If the person is bleeding even at 40,000, the physician may have used his wisdom to give the platelets, right? But the studies have shown that the more people die because of dengue shock syndrome. So the more important is that the IV fluid, when to give, how much to give, and when to stop.
When to stop.
Because after 5 days there is a capillary leakage.
Yeah, which you
there
just
is a
told
sudden
us.
decrease in the blood pressure.
Right.
Sudden decrease in the pulse pressure.
So, in short, this person needs to be monitored throughout.
Yes. That is the time when you have to give more IV fluids.
Yes,
so, the pulse pressure and BP is maintained,
Right.
and platelets are to be monitored. If they go below 50,000, we do it 12 hourly. Okay. And
Okay, I'll come back to
then
that,
we can
Dr.
accordingly
Raheja.
decide
We have
what
with
to
us
do.
a viewer for quite some time. This is Satish Garg from Rajasthan. So, Satish, if you are there with me, what is your question?
My question is that हमारी एक फैक्ट्री है माँ वैष्णो आयुर्वेदिक
जी
माँ वैष्णो आयुर्वेदिक हमारी फैक्ट्री है आयुर्वेदिक
जी
हम दवाइयाँ बनाते हैं डेंगू की डेंगू मलेरिया चिकनगुनिया की सिर्फ 2 घंटे के अंदर ठीक कर देते हैं पेशेंट को कोई एंटीबायोटिक देने की जरूरत नहीं कोई ये अपने कुनैन देने की जरूरत नहीं पड़ती और हमने हजारों पेशेंट ठीक कर दिए पंजाब के अंदर
Ji Satish, thank you for that. Now this actually I do not know how much we can agree with that or not agree with that. This could be contested actually, but yes, it is a matter of Ministry of Health, and so we can't really take a decision on that one. So time for us to slip into another break. When we come back, we'll be talking about dengue fever a little more.
संसद में आता है विधेयक, बनता है कानून, कानून होते हैं आपके लिए, दिखाते हैं आपको कैसे ये कानून आपसे सरोकार रखते हैं। देखिए मेरे साथ संसद से सड़क तक हर सोमवार रात 8 बजे।
Welcome back. This is Healthy India, and today we are telling you all about dengue fever. If you have a question regarding this fever, this is your time to pick up the phone and dial 1800115314 or 23035420. Well, having said that, we have with us Sachipal from Delhi. So if you're there with me, welcome to the show, and what's your question?
जी नमस्कार
जी
मेरी डॉटर है 16 साल की
जी
अभी एक्चुअली इनको बुखार हुआ था तो उन्होंने कहा कि इनको डेंगू का सस्पेक्ट किया
जी
लेकिन हम जब भी तब से मतलब ये 6-7 महीने हो गए हैं जब भी हम टेस्ट करवाते हैं तो इसकी जो रीडिंग आती है वो प्लेटलेट काउंट 60,000 70,000 ऐसे ही आता है
ओके
ये बढ़ नहीं रहा है 2 साल पहले भी ऐसे हुआ था फीवर तब भी यही काउंट आया था डेंगू नहीं निकला था तो क्या वजह है और क्या किया जा सकता है कि इसका प्लेटलेट काउंट हम बढ़ा पाएं?
आपने क्या कहा डेंगू नहीं निकला था
नहीं निकला जी
ओके बट इवन देन दिस प्लेटलेट काउंट इज कमिंग डाउन
जी इतना ही रहता 2-3 साल से
ओके या डॉक्टर पवन वुड यू लाइक टू टेक दिस प्लीज
Basically, the platelet count may, if the patient is having dengue fever, the platelet count rise takes some time. If the platelet count is not rising and dengue is not diagnosed, there may be some other causes of low platelet count in the body, and that has to be investigated thoroughly for other causes.
That's right.
Yeah, like in dengue fever, the platelet count, they will, normal count is 1.5 lakhs to 4.5 lakhs per cubic millimeter.
Okay.
In dengue fever, they will go down below 1 lakh, they may come to 50,000, 20,000, 16,000, and then they will stabilize there. Couple of days or so, and then they start increasing, and the platelet count will get back to normal. That is a normal process, and that is what happens in dengue fever.
Right.
But if the platelet count is persisting low, there may be some deficiency in the bone marrow itself, or there may be some other reason. And for that matter, I think he should consult some hematologist who can really check the blood test, and if required, he can do bone marrow and other investigations, and only then they can know what is the real cause of thrombocytopenia or the decrease in platelet in this particular patient.
Okay. Now, Dr. Sanjeev, there are a number of people who think that yes, Ayurveda is going to work or some other alternate therapy medicine is going to work.
Yeah.
Now, why is it that we cannot really rely on those? And if you have anything to tell us regarding that, since we had a caller, Satish Garg from Rajasthan.
Yeah. There are many studies going on for uses of alternate therapy. So it's a matter of research. I think we need to do some more research, and we have to do some. We have to get some concrete result. Then we can recommend those drugs. Yeah.
Right. Yeah, Dr. Raheja, you want
but
to
always we can say this dengue fever treatment is mainly supportive. So we need to give lots of fluid therapy, oral fluid, and like for fever and body pain, we need to give paracetamol and hydrotherapy as we discussed.
As we discussed.
Yeah,
but I would still want to know a little more.
Nutritious
if we talk of scientific medicine,
right,
there has to be a randomized control trial. If we say this particular drug is effective or not, till the time those studies are not done and we do not have adequate data.
Right.
So, I think it is not judicious to really say that this particular type of medicine is good, this is effective like this. Only after years of research and then randomized control trials, and if the results are fine, only then we can say this particular drug is going to be effective. Otherwise, till then, the only treatment for dengue fever remains supportive care. There is no role of antibiotics, there is no role of steroids also, which I am telling for my doctor's friends. And also, once the platelet count is low, I will request my doctor friends to make a slide of the patient blood, because normally the platelet count is done in a counter. So, a particular size of the platelet is being taken up by that counter, platelet counter. So, if the count is coming below 50,000, it is very important that you make a slide of the patient and then examine yourself under the microscope, because manual examination is really very important to counter check, because it is a very critical decision whether to give the platelet or not. If the number of platelet is 1 or 2 per high power field and you see number of field, the count should be around 10 to 20,000, and if you see clumps like in this slide, you can be well assured that the platelet count is around 1 lakh. So, it is very important in the recovery stage as well as when the platelet count is low to recheck with a slide.
That's right. Well, I think the Dr. Raheja has also given his piece of advice to his fellow doctors as well. So, we just hope that people will take it in the right spirit. And right now, we are joined by Vatsala from Bangalore. So, Vatsala, are you there with me? Vatsala, can you hear me please? Well, we seem to have lost Vatsala for some time now, and okay. Now, Dr. Pawan, I think as far as dengue is concerned, prevention is the best form of cure here.
Yeah.
So, when we talk of prevention, these days, the market is full of all kinds of repellents, whether they are in the form of coils or liquids or what have you.
Yeah.
So, what is the best thing that should be really used and which is the most effective?
Yeah. Once we start with the prevention, let us go by step.
Right.
Prevention, one is the best, one is the residual reservoir where the this mosquito is breeding.
Yes.
Mosquito is breeding, then mosquito is biting the person, the female child, male child, anybody. Then how we can prevent ourselves from biting the mosquito? From preventing ourselves from biting the mosquito, we are galore of these repellents, the nets, the coils we have, and most effective we say it is debatable, but however the vapors, they can be a effective repellent. For the coils, they have a smoking, non-smoking, they are also available, they can be a good repellents. Today in this nets, they are also available with the drugs nets, which prevent ourselves from biting the mosquito. And if we talk about the reservoir, we should take care of the breeding sites. It is around the house or within the house. Overhead tanks, the money plant bottles, the broken tires outside the house, because the mobility of the this mosquito is very less. The 400 meters it can fly or go. Therefore, if the mosquito is there, the number of dengue cases, they are around some clusters only. So, we should prevent ourselves from biting of these. And moreover, if we think that lot of people, they are suffering from dengue from that particular area, we should take preventive measures from that area only.
Right. Well, people, I do hope that you are listening carefully. Well, I'll come back to that, but right now we have with us Rahul Singh from Lucknow. So, Rahul, if you are there with me, welcome to the show.
मैम, मुझे एक चीज पता करनी है, क्या डेंगू में से प्लेटलेट ही खाया जाता है कि कोई अदर ट्रीटमेंट है इसका? कि सप्लीमेंट्स में तो कोई एंटीबायोटिक या कुछ चलता तो है नहीं?
हम लोग बहुत देर से बता रहे हैं, लेकिन फिर भी
डेंगू फीवर है, ये एक वायरल डिजीज है जो वायरस की वजह से हो रही है, जिसका की कोई स्पेसिफिक ट्रीटमेंट नहीं है. इसके लिए जो मैनेजमेंट है पूरी की पूरी सपोर्टिव है. स्टार्टिंग फ्रॉम फीवर के लिए जो हम पैरासीटामोल लेंगे, और हमें एज ए पेशेंट और एज ए डॉक्टर वी शुड बी विजिलेंट, वी शुड बी वॉचफुल कि इन व्हाट स्टेजेस पेशेंट इज गोइंग ऑन. इफ द फीवर सबसाइड्स आफ्टर 4 or 5 days with simple paracetamol only, it is fine. If it is proceeding towards some bleeding tendencies in the body, we should manage accordingly that patient. Platelet rolls come later on. It is only panicky. मैं इस माध्यम से सभी श्रोताओं को, दर्शकों को ये बताना चाहूँगा कि ये पैनिकी है, पैनिकी. बेसिकली अगर प्लेटलेट काउंट अगर नीचे जा रहा है तो 10,000 20,000 तक डॉक्टर उसकी वेट कर सकता है। अगर 20,000 तक है तो भी प्लेटलेट की काउंट की जरूरत नहीं है कि हम उसको इन्फ्यूज करें, अनलेस अनटिल कि उसमें ब्लीडिंग टेंडेंसीज हैं। और ये डिपेंड करता है कि पेशेंट कैसा है, और ये फाइनल डिसीजन ट्रीटिंग फिजिशियन का है कि कब प्लेटलेट है। प्लेटलेट इज नॉट द ओनली ट्रीटमेंट।
That's right. I think this is the message that must go across, that platelets infusion is not the only treatment for dengue fever, because as we've discussed through the program that there are different forms, different types of dengue fever. So leave it to your doctor to take that decision. Don't start treating your patients yourself, especially as far as dengue is concerned. Now, Dr. Raheja, we were talking of repellents and all that, but there are certain repellents which could infuse some kind of allergic reactions in certain people. So in that case, what should be used by them?
Yeah, you know, basically the only way to prevent dengue is stop the mosquito breeding or mosquito biting, right? Now, if the person is allergic to a particular vaporizer, now you know there are available, you know, there are fume based coils, liquid vaporizers are there, and creams are available. If the person is allergic to that particular thing, like to the coil, some patient get asthma or some get allergic reactions, so that has to be prevented, because in allergy or asthma always say prevent the triggers. So the best way to get rid of this situation is, if you are going outside, you can use that creams for the children, because it's a day bitener, and the mosquito is called tiger mosquito. It's a daring mosquito. It tends to bite again and again. And the most important thing is, if the person is having dengue fever, the first 5 days is stage of viremia. That is the only time when the virus is present in the blood of the patient. And if that particular patient is bitten by the mosquito, the virus will be transmitted, will go into the mosquito, and once that mosquito is going to bite some healthy person, it will be transmitted. So the most important is, if the person is having suspected dengue fever, or if ELISA NS1 positive antigen, that person should be kept under the mosquito net. Now we have got the medicated nets, and we should make sure that that person is not bitten by the mosquito, because that will just, as Dr. Pawan has told, the mosquito, this female mosquito needs blood to lay the eggs, and it loves to live near the humans for the food, blood supply. So this mosquito will tend to bite again and again.
So, all right.
So that will transmit the disease to other patients.
So which means it's rightly named tiger, I think. You know.
The only thing is that from one human being to another human being, the infection is not transmitted. If in between the mosquito comes, he bites to the diseased person, then he bites to another so many people to take his feed. So he or she is infecting, in fact she is infecting so many other people.
That's right, since it's Aedes, all right. Well, we have with us Mr. R.D. Sharma from Delhi. So Mr. Sharma, I'm sorry to keep you waiting. What is your question?
Good evening, ma'am. My compliments to you for this beautiful program. I'm a regular listener or watcher of this program.
Thank you so much, Mr. Sharma.
My question is, the low platelet count, can it be because of any other reason except dengue? Because I know a person, the platelet counts are coming to 64,000, from 90,000, 76,000, 73,000, 64,000. What can be the other reasons? Can you kindly
absolutely, yes. Thank you so much for that question. Though we did speak about this, but for your benefit, I'll definitely request Dr. Sanjeev to give the answer to that one.
Actually, there are many causes of thrombocytopenia or decreased number of platelet. So, like if patient doesn't have dengue fever, we have to rule out other causes. Like it is because of bone marrow suppression, and sometimes it is because of other infection also. Like if patient is having septicemia, so it can also cause decreased number of platelets. So main thing we have to do certain investigation. One have to go to the doctor and do the blood test and see the how much platelets are there, and then if required we have to do the bone marrow examination and see the what is the cause. If bone marrow suppression is there, then there are certain diseases we have to treat for those, and then other modality of investigation need to done to rule out thrombocytopenia or decrease number of platelets.
So, Mr. Sharma, I hope you are clear with the answer, and yes, dengue is not the only reason where the platelet count could go down. So, please go to the right competent doctor who can actually diagnose this condition and give you the treatment accordingly. All right, yes, Dr. Raheja, I'd like you to continue there. As you said that, okay, certain repellents could cause allergies, and now that they are mosquito nets which are medicated, I think this is news for me. And where does one find these kind of mosquito nets?
You know, these mosquito nets are available with the nearest government agencies, like in Delhi MCD office, the nearest health centers.
Okay.
And in particular area, you have a defined center where these are available. And even a person can take its mosquito nets and go to a center and get it medicated.
Oh, all right. Okay.
Beside this, the prevention can be done by putting the wire mesh on your windows. By that, the mosquito will not enter your house.
Absolutely.
And the mosquitoes tends to breed in fresh water. The mosquito can, from the larva to mosquito, it takes 8 days to grow, become the full-fledged mosquito. So, in one study, we found that the maximum mosquito breeding occurs in the coolers.
Right.
More than 70%.
Absolutely.
So, it is important that the water in the cooler should be changed on weekly basis. It can grow even in flower pots, money plants, the trays below your fridge, on the water tanks over on the roof, which are not covered tightly with the lid, or any water collection in the small containers
outside
dibbas
the house
and bottles, and so all these are impediments. So, we have to take precaution that the civic agencies can't enter your house. It is the duty of the people to really take care of their home, that there is no fresh water collection inside the home or near in the surrounding.
That's right. Well, people
and even
usually
in that,
think
the
of
resident welfare associations, the residents and the civic agencies, and intersectorial coordination of all the agencies is important. It's not one thing, one person or one individual or the government agencies can control it. It has
well,
to
Dr.
be a
Raheja, I'll have
teamwork
to
by
interrupt you for a second as we are joined by Mohammad Ashraf from Noida. So, Mohammad Ashraf, if you're there with me, very quickly, what's your question?
Hi, my name is Malik Muhammad from Noida. And
right.
I have two questions actually. One is dengue fever and another is called DHF. What is the difference between these two? And first stage is dengue fever and it goes to DHF. And when it goes to DHF, and my second question is I have read in Times of India on 25th of October this month that in Chennai, 2 districts have bought a homeopathic medicine that is called Epotorium profolia 200 something, which is used as an antidote for the dengue fever or all the dengue-borne diseases. Means it can be taken as in advance also, or it can be taken as after the dengue. And it's 600 families has bought this medicine in 1 week, and no one has reported dengue. Is it true? Means I have
Ashraf, I think the answer to your second part is again the same, unless it is contested, unless researchers go into it, and unless the government backing is there for any kind of medicines, only then can somebody really advise this to you. And I do not know whether this television show is enough to do that. Regarding the first part of your question, we'll come back to that, but after this break. So stay tuned, as we'll be back in just a moment.
Do you take pride in being an Indian? Do you know what role you play in the making of India's democracy? Do you know who takes your voice to Parliament? Do you know it all starts with an MP elected by you? Know your MP and be a better informed Indian. Watch Know Your MP every Friday, 8:30 p.m.
Welcome back. This is Healthy India, and today we are talking about dengue fever. Well, we had Mohammad Ashraf with us from Noida a little while ago, who wanted to know about the stages of dengue fever. So, Dr. Pawan, since we were talking about the stages, you can take this.
Yeah, basically dengue fever, it has 3 types: the dengue fever, dengue hemorrhagic fever, and dengue shock syndrome. As we have discussed earlier also, dengue fever is febrile illness of 2 to 7 days duration with fever, with myalgia, with arthralgia, with headache, with pain behind the eyes, nausea, vomiting. These are the general features in dengue fever. Then comes the stage of dengue hemorrhagic fever, we may call it a stage 1 also, in which there is a tourniquet test. If we talk about the clinically, there is a tourniquet test where there is if we increase the blood pressure above the mean, there are bleeding spots on the arm. That is dengue hemorrhagic fever stage 1. Then we have a bleeding tendencies, small petechiae hemorrhages or vomiting with blood, the melena in the stools, and then dengue stage hemorrhagic fever stage 3, then patient can have a cold clammy skin, thready pulse, low blood pressure, narrow pulse pressure, and then again stage 4 the patient can collapse, that is actual shock, patient can go into renal failure. Stage 3 and 4 of dengue hemorrhagic fever, they are also called a dengue shock syndrome. These are the different stages of dengue fever, dengue hemorrhagic and dengue shock syndrome.
Right.
Yeah, the
Yes,
most important
yes,
to
Dr.
understand
Raheja.
is the dengue can be a mild illness and can be a life-threatening
Disease
illness
as well,
also.
right.
If not
Dengue fever is simple fever, then dengue hemorrhagic fever, dengue shock syndrome. Like we had a patient who had dengue shock syndrome. It involves every organ of the body. There is a serositis, collection of fluid in the abdomen, what we call ascites, can be in the pleura, pleural effusion, and patient can have intractable vomiting, headache, and dehydration. Beside this, in one patient, we had decrease in the heart rate also. The pulse rate, the heart rate of the person went down to 42. We just monitored the patient in the ICCU, put it on the monitor, and I will like to tell it stabilized automatically, and the heart rate came back to 48, 56 and back to 72. And today that patient is absolutely hale and hearty. So, the most important is don't panic.
That's right.
Emergency means urgency. If any patient is having dizziness, vomiting, intractable headache, or patient is getting delirious, it is very important that the person is taken to the hospital where the proper blood examination can be done, and if the platelet count is less than 50,000, we advise the patient to be admitted, and the platelet, blood pressure, pulse pressure should be monitored.
Right, and I think those are the decisions that only doctors can take. Well, finally, would you want to give some take-home message to the people in terms of prevention or cure?
Yeah. So, very important thing, don't be panicked. Always come to the doctor. When you have fever, come to the doctor, discuss about your illness, and don't be panicked. Doctor have to assure to the patient, it is a treatable disease.
That's right.
It is not a life-threatening disease. So, do the supportive treatment, and prevention is also very important, as told by Dr. Pawan. We take precaution. There will not be breed surroundings of your home, inside the home, and like in kids, we have to give supportive creams and all when they are going to play, and they have to cover the arms and limbs to prevent the biting of the mosquito.
All right. So, Dr. Pawan, what would you like to tell the viewers?
Final message for the viewers is that this is the problem of a mosquito. And society, the people, the RWAs, they have to come forward for the awareness regarding the dengue. It is a disease of cleanliness only. The mosquito resides around the uncleaned area, the water which is collected around the house or within the house. If we as a citizen, we are cautious that we should not allow to breed the mosquito in our area, we are not having a dengue. The government machinery of health department is working. The hospitals, they are working, platelets are there, everything is there. But however, as a general citizen, we should be taking care of cleanness in and around the houses. We should not allow to collect the water.
That's right.
We should not allow to breed the mosquito.
What would be your final words,
The take-home message is prevention is better than cure, and mosquitoes are more than humans, and they are dangerous. Mosquito can not only affect, spread dengue, chikungunya and malaria, and for all these we don't have any vaccine. So, the only way we can prevent ourselves, our society, our nation is by stopping the mosquito breeding.
That's right.
And that is a teamwork. It starts from the house, RWA, your neighborhood, civic societies, civic agencies, government agencies, they have to work together in good coordination to control the mosquito breeding, because as such there is no vaccine as on today.
That's right. So, well, I think that's very important to remember, that there is no vaccine till date. So, prevention will be the only cure. Well, before we go, I'd like you to take a look at this recap of whatever we've discussed so far.
Of dengue: chills, flushed face, increase in temperature, rash and headache. Rash consists of small red bumps that begin on the arms and legs but then spread to the back, abdomen and chest. Lower back pain and general weakness. Red eyes and eye pain. Severe joint and muscle pain. Swollen lymph nodes. Soles of the feet and palms of the hands also turn red and swell. Key facts: Dengue is a mosquito-borne infection that causes a severe flu-like illness and sometimes a potentially lethal complication called dengue hemorrhagic fever. Global incidence of dengue has grown dramatically in recent decades. About 2/5 of the world's population is now at risk. Dengue is found in tropical and subtropical climates worldwide, mostly in urban and semi-urban areas. Dengue hemorrhagic fever is a leading cause of serious illness and death among children in some Asian countries. There is no specific treatment for dengue, but appropriate medical care frequently saves the lives of patients with a more serious dengue hemorrhagic fever. The only way to prevent dengue virus transmission is to combat the disease-carrying mosquitoes.
Well, those were certain important points that you all need to keep in mind. Well, before I go, I'd like to tell you that keep writing into us and keep telling us as to what you think of our shows and what more you would like us to do for you. For that, you need to write to me on this address.
Healthy India, FB 116, Lok Sabha Television, Parliament Library Building, Parliament House, New Delhi 110001. Email healthlstv@gmail.com and our toll-free number is 1800115314.
Well, I'll wait for all your mails, so do keep writing in. So let me say thank you to all three of you for coming today and for talking about this condition. Well, people, I think by now we are all aware that dengue fever is one fever that can be prevented only by not allowing mosquitoes to breed in and around our surroundings. And remember, no self-medications. Please go for those tests. And the best thing that you can do is use repellents in any form that suit you, because that's the only way that you can prevent mosquitoes from actually biting you and for this disease to take charge on your bodies. So just remember, and also remember that the medications, the alternate therapies and everything that is there, all that will come later. First, go to the right doctor who can diagnose your condition and actually treat you. Self-medication is not going to help. So keep all these points in mind and you can definitely take care of from dengue fever at least. Well, with that, it's a wrap up of today's edition of Healthy India. I'll see you next week with something equally engaging. Till then, this is Lottie Alaric saying goodbye and take very good care of your health.